Hello once again, you're welcome to my channel, and on today's episode we'll be continuing from the last episode where we discussed about common mistakes and the risk associated with the misuse of OTC drugs. As a recap, OTC drugs are basically over-the-counter medications. They are medications intended for self-treatment for a short period of time of very minor ailments. These OTC medications are easily accessible, but that does not take away the fact that if they are not properly used, they could lead to medication errors or side effects. In the last episode, we listed 3 of such common mistakes and the risks associated with the misuse of OTCs as 1. Overdosing. Yes, overdosing. The second one is the common mistake of mixing OTC drugs with other medications that may have similar active ingredients, thereby leading to increased concentration of a drug in the system or potentiated side effects. And the third common mistake we discussed about in the last episode was taking OTCs for a long period of time without consulting healthcare providers. That way you may mask very serious disease conditions by treating the symptoms with OTC drugs. In this episode today, we'll be continuing with other common mistakes and the risk associated with the misuse of OTC drugs. Another common mistake associated with the use of OTC drug is using OTC medications for the wrong indication. For you to effectively use OTC medications, you should be very sure of what you want to treat and the drug that can bring about such treatment. For instance, someone who has a productive cough, that is to say, a cough that comes out with mucus and most people call it wet cough. You should be looking for a cough preparation that would break down the mucin of the mucus and enable you, easily cough out this mucus to feel better. There are different types of cough. So if you have a dry cough, you should be looking for an OTC preparation that suppresses, the cough reflex. If you have a dry cough and you're taking a mucolytic, that is to say a drug that is supposed to break mucus and help it to be easily released, if you use that kind of a drug for a dry cough, you will simply wasting your time because it's not going to do anything for you. Why? You do not have a dry cough anyways, So that's one of the common mistakes of using OTCs when you're not using it for the right indication. Ignoring label warnings and expiry dates on OTC medication is another source of mistakes when using these drugs. When you get an OTC medication, please take your time to read through it. There are times when you see not to be used by pregnant women, or do not give to children below 6 years old, or use with caution in the elderly. Those are not just fillers. They are not written there for the sake of it. There are reasons why these warnings are placed on the drug. So please do not ignore such warnings. There are drugs that should not be used by children of certain ages because their systems or their organs may not be mature enough to properly metabolize or excrete such drugs out of the body, and it can lead to toxicity. The same thing is true for elderly people. Because they have slower metabolism, such drugs should either be totally avoided or used with caution in the elderly because of the slow metabolism and excretion of those drugs from the body. When these drugs are used without paying mind to these warnings, it can lead to toxicity, it can lead to increased side effects, it can even lead to organ damage in these persons whom we have been told not to use the drugs for. For pregnant women, drugs can be harmful to the baby in the womb. Some drugs cross these barriers to actually affect the baby in the womb. For instance, tetracycline is a drug that every pregnant woman should avoid, especially in the first trimester. Why? Use of tetracycline in pregnant women in the first trimester has been known to produce yellowing of the teeth when the baby is born. So please take note of all labels on OTC drugs and make sure you abide by them. Another common mistake we make while using OTC medications is not checking for the expiry dates. Drugs have shelf lives. That is to say, they have a period within which they must be used in order to give the desired effect. So if drugs are used after the expiry date, the person using it runs the risk of introducing foreign or harmful substances into their bodies. One. Secondly, such drugs may have been deactivated and it will not elicit any therapeutic action. That is to say, it will not produce any result. You would only be wasting time taking such drugs, and that would be the mild consequence. There can be worse consequence, which can be organ damage, or it will elicit very undesirable side effects that can be really harmful to a person. Lastly, most people take OTC medications without consulting their healthcare provider, and in most cases the pharmacist, who is always present in the pharmacy when they go to get this drugs. It's always good to consult your pharmacist because he or she would give you professional advice that will be beneficial to you while using your OTC medication. We often make the mistake that because a person, a neighbor, a friend has used a particular drug and it worked for them, it would also do same for you. You may have similar symptoms that may not quite be the same, but talking to your pharmacist will avail you the opportunity to get the correct drug to be used, the right dosage to use them, and if possible, you would also be directed on how to make use of these OTC medications if you also are on other prescription drugs, or if there are any other underlying conditions that you may need to be careful about while using OTC medications. So why not? When you walk into a pharmacy, the pharmacist is always there. Why not consult with the pharmacist so you get the best medicine advice at that particular point in time? I hope you were able to get one or two things that was useful to you in this video. If you did, please like and comment what you gained from this video. Do not forget to share and join me in the next episode. Until then, remember that the pharmacist is your friend and he's a medicine expert. Stay in good health.